in a hospital boardroom somewhere in America. The case of Whitney Ross. What went wrong? Whitney was a sophomore in college, an excellent student with dreams and goals. She came to be in post-op after having an appendectomy.
Yeah. But this IV line still really hurts.
Well, like I said, I can try moving it to the other arm.
Yeah, whatever you could do.
Is that a rash?
I told them when they took my history.
Okay.
Sorry to be such a bother.
I'll be back in just a minute.
Okay.
The probable source of the infection was down the hall. Tom wasn't even supposed to still be there, but he contracted a MRSA infection at his surgical site. His daughter, Kelly, unfortunately didn't understand that even though she was just a visitor, she was also a part of the healthcare team.
Hey, my dad could use an extra pillow for his back.
Okay, I'll bring you one in just a second.
Dina, she wasn't going the extra mile to ensure the safety of patients.
If you could get to us soon.
I just need another minute or two, and then I will bring you a pillow, yes.
Okay, thanks.
She recognized Kelly wasn't using the gloves correctly.
Whitney's IV still hurts. I'm going to try moving it to the other arm. Can you cover Mr. Daniels for a few minutes?
Yeah, I wasn't going to finish this anyway.
Nathan? He was the director of the post-op unit. He'd come back from a conference on patient safety and infection control, but he never instituted a sustained effort. So an otherwise responsible new nurse just out of school never got the message. She was using gloves, so she didn't also feel the need to wash her hands. The infection preventionist working with post-op was Janice. Janice couldn't successfully implement a team approach to infection prevention.
Hey, can I talk to you for a minute?
Why? What's wrong?
She was always considered an outsider, and so everyone's awareness of healthcare-associated infections suffered as a result.
Is it cold in here?
I don't think so, but I can get you another blanket.
The nurse made a note in a chart, but didn't alert anyone until after shift change.
Temperature is 101, blood pressure 145/97, nothing moving in her GI tract.
Thanks.
Manuel, in his third year of med school, he longed to make a difference.
A temp of 101 is fairly typical for appendicitis. Let's monitor the postoperative ileus for 24 hours.
But the patient got worse.
What concerns me is her arm. Look.
Manuel had been watching the case all day. He suspected the patient's condition was getting much worse.
I saw that. Monitor for peritonitis. I'm on call this weekend. Alert me if she doesn't respond.
But Manuel's rotation in post-op was almost over and he didn't want to stick his neck out. Manuel accepted the attending's course of action without objection. It was a chain of events that should not have happened. And then?
Dr. Green, everyone, the ICU just called me. Whitney from 204, she had a MRSA infection in her bloodstream. She passed away.
Any one of several individuals could have made a better decision, and Whitney might be alive today. Everyone knew that a patient had just died from poor infection prevention and poor communication. But you know what? It doesn't have to be like this. This is not reality. You have a second chance to go back in time and make new decisions as 5 of these characters. See if you can make choices that will change their approach to healthcare-associated infections and prevent this outcome. Get it? This is you. This is you. This is you. This is you. And this is you. Go back in time and make better decisions so that this is you.
Doctor said I healed up fast.
And not this. Take a walk in their shoes. If you're smart, we can improve quality of care and save patient lives.